Good afternoon, everyone. Welcome. I hope you are having a great day. I'm excited for our session today. It's 2 o'clock now. We've got folks joining us, um, and we'll get started very shortly. If you'd like to say hello in the chat, that would be lovely. Um, just like our other sessions, all of you are muted and your cameras are off. And then we will ask you to write comments or questions in the chat, and we will be monitoring those throughout. So again, welcome. We're just getting people logged into the room and yeah, getting settled today. We are going to do our 5th session in our training series. This one is on environmental health inspections of our congregate nutrition sites. We are joined by Angie Pinion, who I will introduce in just a moment. But it's great to see so many of you here today. And yeah, we'll take maybe a few more moments to get settled and then kick it off. Yes, and I see some of you are watching with others. That is lovely as well. Just like in the past, for the past sessions, if you are watching with a group of people, we'll have you email Shania Gales, and she can put her email in the chat to let her know who was present so you can get credit for this training. Okay. So let's go ahead and get started. So if you have not joined us before, my name is Julie Sunderman. I am the nutrition program consultant at the Division of Aging, and I oversee our congregate and home delivered meals programs, among some other duties as well. And thank you so much for joining us. I hope you were present for some of the sessions over the fall. And this is, I think, a great way to kick off 2026 with this training session today. And we are joined by Angie Pinion. So you'll see her camera on right now, and she's going to take over the training in just a few slides. But just to sort of put this training in context, this is our 5th training in our nutrition program training series. And we have not sent out certificates yet. I know we're behind on that, but just so you know, those are coming. They are pretty much ready to go. But of course, there's just a few little details we need to work out internally to kind of get those out to you in the most efficient way. So I apologize that you don't have those yet, but they're coming soon, and our recordings are very close to being ready. We are also recording today. So thank you to Angie for agreeing to do that for us. I think it's going to be so helpful to the network to have this training to refer back to. And those will all be available very, very shortly. Again, just working on kind of the final instructions about how to access those. And when this training is finished, we will send you an evaluation link so you can tell us how we did today. Please, those are so important to us to get that feedback. So please complete the training. We'll share that with Angie too, so she has it. We will send the slides and any links that we share today, and then shortly after that post-session email, we will send instructions for accessing the recordings, both for yourself, so you can go back and rewatch if you want to, and for any new staff that may be joining you in 2026 who need to start training on the senior nutrition program. So we'll have instructions for how they can access those and receive credit for that training. As you know, this training, all of the sessions we're calling this the nutrition director training. This is what's going to be required for nutrition directors moving forward, and it will replace those YouTube videos that we have been using for the past 5 years. So we are updating and modernizing, which is great. Okay, so with that said, I'm going to turn this over to Angie Pinion, who is one of our regional environmental health specialists. I'll let her introduce herself. But she presented at our in-person training in October. It was fabulous. Many folks who completed the evaluation there said her section of the training was their favorite part of what they learned. So I knew we needed to invite her back, and I'm so pleased that she is joining us today. And so without further ado, I'll hand it over to her, and just please if you have questions as we go, type those in the chat. We'll try to flag those and she'll answer kind of in real time if they're relevant to what she's talking about. But if it's sort of a different question that may be related to environmental health but is not specific to that section of the training, we may hold that question and talk about it at the end. All right, thanks, Angie. Go ahead and share and I'll let you kick it off. Thanks.
Thank you so much, Julie, for those kind words. I appreciate it. Again, I'm Angie Pinion. I am an environmental health regional specialist within the food protection branch, which is a part of the environmental health section of the Division of Public Health with the Department of Health and Human Services. So that doesn't all fit on a business card. You're going to have my contact information very soon. Can you see my screen?
Yes, it looks great, Angie.
Okay, very good. Let's see. Just a second. Okay. So we're going to talk about the inspection of congregate nutrition sites. And I wanted to show you so here's a map of North Carolina with all these different colors. And you'll see that it corresponds to a different name and phone number over on the bottom left of the screen there. These are all of the environmental health specialists that work in the food program within North Carolina. There's 11 of us. So if you see your county on there and you want to possibly use this name and number in the future, it could come in handy. If you have your phone, you may just want to pull it out and just take a quick picture so you'll have it. In the future, you're going to get a copy of these presentations as well. But if you need that phone number before the presentation is sent out, I would recommend taking a snapshot. At the end of the presentation, this will be shown again. So no worries if you don't have your phone near you right now. I will show this slide again at the end. And just wanted to point out that we are like kind of regionally based. I actually live in Davidson County, so I am coming to you live from Lexington, North Carolina, right in the Piedmont area triad of North Carolina. I cover Davidson, Forsyth, and this little old county down there in the bottom called Mecklenburg, which, they have 60 food, and we're just going to use the word inspector. Because I know sometimes people don't know what an environmental health specialist is. We're just a food inspector, really. That's the common name. But Mecklenburg keeps me busy. We provide a lot of training to new interns that come into the field, and we also provide a lot of training for existing environmental health specialists. We help with rule rewrites, which is coming up very soon. All of our rules have to be reopened and either readopted or rewritten every 10 years. And that cycle is coming up again. So there are over 300 rules that have to be looked at. So our job is about to get really involved in the next few years. So without further ado, let's go ahead and get started and we'll talk about congregate nutrition sites. So our objectives for today is we're going to have what the basic requirements are of a congregate nutrition site, um, keeping food safe. Are we cleaning and sanitizing utensils? What are your emergency procedures? And also, I'm sure y'all work with the local environmental health specialist there at the local health department, and then we'll take any questions at the end. And Julie, just so you know, I cannot see the chat, so you may have to just flag me down if there's a question.
Sounds good.
Okay, thanks. Okay, so first of all, what is a congregate nutrition site? They are, and this definition is actually found in our 2600 rules. So you may hear me say 2600 rules throughout the presentation. And what that is the set of rules that we use to govern food safety in food establishments in North Carolina. So under 2651, congregate nutrition site is defined. It is a food establishment where food preparation is limited to same-day service, reheating of what we're going to call TCS food, so that's your potentially hazardous foods, and operated under the rules of the Division of Aging and Adult Services. Sometimes these facilities will be called elderly nutrition sites or Meals on Wheels, those kind of things. So all those terms are kind of used interchangeably. So there's been a lot of conversation over the last 5 years surrounding whether or not certain congregate nutrition sites should be inspected. We have COVID to thank for that. Unfortunately, everyone was trying to find ways to still provide a service. And of course, in your case, you still wanted people to get the food that you guys were normally providing in a group setting, and we wanted to get that to those participants. So we do recognize that the population that you're serving is a highly susceptible population, and we need to do it in a safe manner. I think we all can agree on that. Unfortunately, North Carolina Administrative Code does not change overnight. So this code that's on the screen, 10A NCAC, and that is 06K.0202, says that all congregate and home delivered meals shall meet the requirements in, and I'm going to abbreviate this, the 2600 rules, which means no matter if you're serving from a bulk container or if those foods have already been maybe from the catered establishment, maybe they have been packaged and you're receiving like a sealed meal, like you're not doing any sort of food handling, you're just turning around and handing it right to a participant. And again, it could include portioning and serving meals for participants there on site. So this administrative code applies to both of those situations. And we have seen where there's been a lot of questions from environmental health specialists across the state that why are we inspecting packaged food? Because technically, just to give you an idea, we do not regulate foods once they're packaged. That becomes a Department of Agriculture inspection or regulation. They're not going to inspect it. It's just under their jurisdiction. So until this rule changes, it's on the screen, we are still inspecting congregate nutrition sites across the state. Now, you may have a situation where the health department is saying, no, 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 we don't do that. We need to know about that so we can contact that local health department and let them know that, yes, they should be making or doing an inspection. They can spot check food temps, sandwich, the meals between each other. There's still ways to, or maybe even the facility will send you an extra meal that you guys can sacrifice and you can open and actually take temperatures. Because once you receive that food, you want to make sure that it is at proper temperature before you're actually handing it off to a participant. So again, all congregate nutrition sites that meet that other definition that was on the previous screen should be getting an inspection. I know that there are plans for to maybe rewrite this uh, rule, and I believe Julie and we've talked on the side that we're available if you guys want to create something and we want to look at it to see if there's going to be any sort of issues, and so we're going to work together to come up with a solution and what is best for your program. Okay, so when we're talking about inspections, um, the Congregate Nutrition Site is going to get a routine inspection. You guys are classified as a highly susceptible population, which automatically is going to put you into the category of a Category 4 establishment, which we have different categories and it's all based on risk. And since you do serve a highly susceptible population, you're going to get that you are categorized as a Category 4. And so you're going to be inspected under our 2600 rules. And that inspection is just going to cover some basic facility requirements, food protection, and cleaning and sanitizing of equipment. There are some exceptions that we have in those rules that do allow the use of, like, for instance, and I'm going to show you here on the next slide. So here we allow domestic and residential equipment. It just has to be in good repair. We want to make sure that you have heating equipment, whether that's a microwave or it could be an oven or a range, just some way that in case the food is delivered not at temperature and you can't send it back, that we want to make sure that the food can be reheated and served at a safe temperature. And that requirement is also found and some other basic requirements in 2673. Here on the screen, you will see the picture on the left is looks like a 3-compartment sink for you to wash, rinse, and sanitize utensils. The minimum requirement is a 2-compartment sink, which you can see in the picture on the right. It's a little hard to see, but that's just like a drop-in sink that you would probably have at your home. As if this facility is cleaning and sanitizing utensils on site, you would need to make sure that those are being done properly. And it's going to depend on like the location that you're at as to what type of equipment that you have. It's a lot of times we see congregate nutrition sites in churches. Churches usually sometimes will just make the kitchen look like your home, maybe just on a larger scale. And then there are some commercial kitchens which you're going to see on the left there, which would be an approved piece of equipment. Also some other basic requirements. A utensil sink, we don't want to dispose of mop water or cleaning of garbage cans in these sinks. So please make sure that that is being done elsewhere. But don't dump that stuff in the storm drain, please, because that can cause even more trouble. But just make sure we're not dumping mop water into these sinks because that can cause some cross-contamination. Other basic requirements. So this is showing pictures of the picture on the left. That is just a regular old, what we call a mop sink or a utility type sink. And the sink the fixture on the right is what we call, we call things such different things. It's actually considered a service sink in the food code, but with this one, we call this a mop sink or a can wash, because you can wash your trash cans in it. That's another common term that is used. So what we want to happen is make sure that you have garbage can liners for all your garbage or garbage cans. So that way that the chances of any spills, you may have to double bag, um, and a leaky bag or whatever. You're trying to prevent from having to clean those cans with like flood type cleaning. So if you have a facility as pictured on the screen, then you don't have to be as cautious with garbage can liners. But that's, we want to make sure that what we call the can washer utility sink is, it has hot and cold running water, making sure that it does go into the wastewater disposal system, whether that be an on-site wastewater system or a municipal. Maybe you have city sewer. Other basic requirements. Sometimes you may be asked, hey, do you have your Serve Safe certificate? Or have you attended any sort of food safety training? Are you a certified food protection manager? Those are all three questions that you could potentially be asked. But guess what? You guys are not required to do that according to our rules. You do not have to have a certified food protection manager. Now, you do have to have what we call a person in charge. There needs to be someone there that is overseeing that operation for that day and can answer questions related to food safety and sanitation when the health department does come to do your inspection. So you're not required to have the certification according to our rules. Okay. Other requirements. So if you are reheating food, like leftovers, that's not allowed. Um, we want to make sure that, because in most cases, a lot of these facilities are using domestic refrigeration, and our at-home refrigerators are not designed to cool foods. They're just really meant to hold foods. And it may be at a huge quantity too, depending on how many participants you have. So we want to make sure that all the food is coming from an approved source. Is the location, maybe it's a delivery service, it's a restaurant or a caterer. We want to make sure that they actually hold what we call a 2600 permit. And we want to make sure that there's no home cooked or home canned foods. We can't have that in our congregate nutrition sites. Reheating is going to be limited to, so if you are a facility where you reheat food there at your site, we want to make sure that it's just reheated is where I'm getting at, not any cooking. So if it's a Stouffer's lasagna and that's what you're serving, that's all that is pre-cooked. It just goes in the oven, and you heat it up and then you can serve it. We just don't want any cooking of raw animal foods or anything there on site based on the type of equipment that you have. You probably don't have a hood. So there's all these other kind of things that comes into play. So basically just reheating commercially prepared foods. And then again, we can't cool foods, so therefore we should not see what's pictured there on the bottom. We shouldn't see a bunch of looks like leftovers in some containers, and that's in the freezer or in the refrigerator. That food cannot go back for reheating and then serve to any participants at your site. Okay. Yep. So that's what we don't want to see. Okay. So other basic requirements, the utensils have to be washed, rinsed, and sanitized. And in most cases, a lot of the establishments, when they receive the food, they're getting it from a location and they're bringing utensils with them a lot of times. And then part of that drop off of that food and utensils is to pick up maybe heated bags or, the utensils from the previous day. And then you send them back and they go back to that facility for wash, rinsing, and sanitizing. Any utensils that you are using and cleaning and sanitizing there on site, you need to make sure that you have the approved equipment to be able to do that in, because it is a 3-step process. And it's very hard to do that in a 2-compartment, like residential style sink. So in most cases, the utensils are being sent back to the caterer or restaurant that they received the food from. Okay, so we also want to make sure that we're keeping our food safe. Um, we ask when we're there doing an inspection, your environmental health specialist, with the local health department, should be asking you about an employee health policy. And so in doing that, they're actually kind of doing their job. They're the person in charge. They should know that if any of their staff or any of the volunteers that are helping in the kitchen, so make sure. I know sometimes when I was at the local level, the sites that I was at, there were several participants that actually would help with the serving of the food or assisting in the kitchen with making sure everybody had what they needed. They were in there, maybe even just kind of rinsing, not really washing the utensils, just kind of getting all the stuff off. So they were actively involved in handling of, and it could be just milk, but we can also contaminate milk because you usually drink out of the carton. And so we want to make sure that everyone is healthy and well, feeling well. We don't want anybody there handling food while they're sick. We definitely don't want any bare hand contact. So if, a bag of rolls comes with the meal, and we don't need participants touching, or even employees touching the food with their bare hands. So they should wash their hands and put on gloves, or use like a pair of tongs or a utensil so they're not actually touching the food. Make sure the food is at a safe temperature. And that can be either done, or say a temperature. It could be used a time. You might receive the food, and once the food is removed from temperature control, and that could be while it's at the restaurant, or it could be once it comes off of that delivery vehicle. It may be a situation where the vehicle actually has temperature controlled environment within the unit. It could be like a hot holding unit on that van or delivery vehicle. And so removing that food at that time was when time would start. You have up to 4 hours to either serve the food, or it has to be discarded. But just remember, we are serving a highly susceptible population. If you receive food that is temperature abused, then you guys should have a plan in place of what you're going to do. Sometimes if the caterer or the establishment where you got the food from is pretty close, it may be that they just need to bring you another more food, or you have the ability to reheat that food. And of course, any cross contamination, we don't want that happen as well. So when we talk about good personal hygiene, we talk about we want to make sure our outer clothing is clean. Make sure that if we have pets at home, that we've used a lint roller to before you go into the kitchen, to make sure we're not shedding any pet hair into the food. Making sure we wear an effective hair restraint. And that can be done with an actual hair net. It can be done with a ball cap. I've seen others use, maybe they use a combination. Maybe they use a hair net and a sun visor. Just as long as the food is restrained, and there's no potential of it getting into the food. We want to make sure that we, as far as rings on our hands, so I could not actually participate in the act of handling of food because I have stone jewelry on my hands. If only had a plain band, then we would be okay with that. That's the only exception. Also acrylic nails and nail polish. My nails are actually polished as well. So I would need to take the jewelry off, and I also would need to put gloves on if you have nails or nail polish before you're handling food. That is more of a physical contaminant than anything. I mean, the polish itself, I mean, it could flake off. There's even been stories of people's artificial nails, their press-on nails or whatever, falling off into someone's food. That is not what you would want to find in your mashed potatoes or whatever. That is just not that's not the way you want to. It's not something you want to experience. Um, Also, no bracelets, and that includes medical bracelets. You need to find a different way. If you have a medical reason to have a bracelet on, you may want to find a necklace. Maybe you need to make it into an anklet. Um, find another way just so your medical bracelets are no, you're not wearing any sort of medical bracelet. Okay. So next is hand washing. So when we talk about hand washing, we also, when we have the 2600 rules, but our 2600 rules also reference the food code. And so a lot of this stuff is coming from the North Carolina food code. We've based it off of the FDA model. And so when it comes to hand washing, the food code actually gives a step by step on how you're supposed to wash your hands. And we want to make sure everyone is doing it the correct way. Wet your hands, apply soap, make sure you're scrubbing. And you want to do that for 10 to 15 seconds. And then you want to make sure you rinse your hands. And you want to dry your hands with an approved method. And that could be a disposable paper towel. Um, it could be a hand dryer, which is uh, not the most, I guess, sanitary, because then you got to figure out a way to turn the faucet off, unless it's one of those that you activate like with your knee or your foot. If that's the case, then a hand dryer could work. But in most cases, everybody's using a paper towel. So you want to make sure you dry your hands and then use that paper towel to turn the water off. Because if you don't, your hands, when you touch that faucet handles to turn it off, that is considered recontamination. We do not consider a hand sink clean. We consider it a soiled piece of equipment. So therefore, you're touching a soiled piece of equipment when when you turn the faucet off with your hands. So make sure you're using that paper towel. And again, the whole process should take about 20 seconds. So saying happy birthday to yourself twice, and that will get you your 20 seconds. Okay, so we talk about when to wash. This here is something we see a lot, not typically in our congregate nutrition sites. It's mainly in our other restaurant facilities, is they're not washing their hands when they're supposed to. So the food code actually lists, and this is not it's not a full list. This is just some. So after they go to the bathroom, they should wash their hands in the restroom. And they should wash them again when they get in the kitchen, because they could have touched doorknobs and other things. After you touch your face or your hair or any part of your body, before and after handling raw foods like meat or poultry, after you take out the garbage, after you sneeze or blow your nose or using a tissue, after handling chemicals or cleaning. So if you are, cleaning utensils in the sink in the kitchen, or maybe you're spraying sanitizer and wiping down the counters, that you would need to wash your hands before going to handle any food. Of course, any smoking, chewing gum, or using any sort of tobacco products, because it's a hand-to-mouth activity. So make sure you wash your hands. And of course, after you eat or drink, unless it is a container that you're drinking from that, is you can actually drink from it and just set it back down, and not having to touch the mat. So like this bottle of water, because you have to touch the where your mouth goes to take the lid off. I've already taken my lid off, but where you have to do that, then it's that's like a hand to, you might as well have just touched your mouth because your hand is touching that same thing. So making sure you're washing your hands. Where to wash. So we want to make sure that we only wash our hands in the designated hand wash sink. We should not be doing that in the what we've designated as a utensil sink. Make sure the utensil, or I'm sorry, make sure the hand washing sink has soap, some sort of hand drying device, which could be paper towels. It has hot and cold running water, and that there's a hand wash sign. Please make sure that you don't use the hand washing sink to dump mop water, which is what you see there in that picture. Make sure that we don't want to prep any food here. So if you're slicing up tomatoes to go with lunch, we don't want to go rinse them off in the hand wash sink. Again, remember what I said about on the previous slide. The hand sink is considered a soiled piece of equipment. Make sure we're not like rinsing off any cleaning tools or equipment. We see this, that one is more of a violation when we are thinking about, and what comes to my mind is inspecting a facility that does sushi. So that sushi chef wants to rinse off the knife that they just used to cut up that roll. And they go over to the hand sink and run it under the hand sink before they use it on the next one. So we don't want that to happen either. Okay, so when we talk about bare hand contact with food, and that's a great picture there on the right of actual bare hand contact. It is strictly prohibited. This has been in our North Carolina food code for over 13 years. And it is amazing to me how we still see this as a violation. This right here is definitely can cause a foodborne illness, especially if this worker might have been caring for a sick child at home that could possibly have has been having vomiting and diarrheal events, and this mom here is the one that has been cleaning up after that child, and then now she goes to work and she handles this food with her bare hands, and that right there is the way that norovirus is spread. Or maybe she has it, is shedding it as well. So make sure we're using single-use gloves, that we can use utensils like tongs. You can use deli paper, if it's a situation where you're this is not really going to be, well, I don't know. You guys could probably do it. Taking deli paper and getting that in that bag of rolls I was talking about earlier. Instead of using tongs or gloved hands, you could use a deli tissue paper and grab a roll out of that bag. And that would be okay as well. And we just want to make sure that we wash our hands prior to putting on gloves. And we're going to talk about this using your gloves properly. So pay attention to your gloves. It's amazing how when people put gloves on, they're obviously their hands are clean because they're underneath the glove, but they'll touch anything and everything with a pair of gloves on. So be very cautious with that, and don't do that. Just make sure that when you see that the gloves have become damaged or they're just extremely dirty. And whenever you think you need to change them, take them off and wash your hands and put on a new pair, your instinct's probably right. Let's go with it. We don't want to wash our hands with our gloves on. We want to take those gloves off. These are single-use gloves. They're not reusable. We want to make sure that you wear gloves over a bandage if you have a cut or a burn or a rash on your hand. So I know y'all probably can't see this, but I do have a Band-Aid on my forefinger here. So I, minus the jewelry, wouldn't definitely need to be wearing a glove on my hand, even if I am using utensils to scoop out your food, I still must wear a glove to just in case there's any sort of issue with the cut that is on my finger. Want to make sure that also, I think I mentioned this before, wearing gloves over artificial nails or nail polish when you're handling food. Okay, so I mentioned this a little bit earlier about employee health policy. We want to make sure that any food, and we call them food employees. So it's going to be your person in charge, whoever's running the Congregate Nutrition site, and any employees or participants that are helping with the handling or serving of that food. We want to make sure that all of them understand that if they have any symptoms of vomiting, diarrhea, jaundice, which is yellowing of the skin or eyes, a sore throat with fever, not just sore throat or fever, it's got to be both. And then any lesions that, so we call this infected cuts or wounds. So these symptoms, if any of the food employees have these, they may not work with food that day. They need to be excluded. We just want to make sure because all of these symptoms here can definitely impact food and actually cause foodborne illness. And so we need to be very careful. The infected cuts or wounds, actually, that is more of a staff concern. And so we definitely don't want anyone getting a staph infection from an infected cut or wound of a food employee. So we would just need to know. And so every Congregate Nutrition site should have an employee health policy. And we're going to continue this on the next slide as well to talk about it. But we want to make sure that if any employee is experiencing any of these symptoms, they do not need to work with food. Also, if they have been caring for an individual that has any of these symptoms, they really should not be working with food. Now, the infected cut or wound, that one is going to be excluded, but it's more so vomiting and diarrhea is the concern because that's norovirus that we're really highly concerned about. There is also a requirement. Let's talk about the illnesses first. Okay, so another part of the employee health policy is it requires food employees to report if they have any of these following illnesses. So if they have norovirus, they cannot work with food. Hepatitis A, not B, C, or any of them. It's hepatitis A, which is these two, and also Shigella, are the fecal oral route. So unfortunately, I know that's paints a very ugly picture. But this picture is actually really, really kind of cool. So this is either a bacteria or a virus that is on the fork, and then the person is about to consume it. So number 4 here is E. coli. So we're really talking about O157H7, typhoid fever, which is the Salmonella typhi. And then we also have non-typhoidal salmonella. So there are 6. This is what we call the big 6. And you'll hear other people. At one time it was 5, but it's been 6 now for over 4 years. And so we want to make sure that any of your employees or participants have been diagnosed with any of these, they may not work with food. And we talk about employee health and also their right to report to the person in charge, but also there's a responsibility of the person in charge to report to the health department if they have an employee that has been, that is jaundiced, which means, the yellowing of the skin or eyes, or if they've been diagnosed with any of those reportable illnesses. So if they have jaundice or the big 6, the person in charge should be calling the health department to notify them that they have someone And then they will be able to help you with determining whether or not they need to be excluded or restricted. And there's this whole big employee health guide, and that can be used. There's these flow charts, depending on the symptom or the diagnosed illness. There's all sorts of resources out there to be able to determine whether they can be excluded or restricted. And when we talk about excluded, that means they cannot work in the food establishment at all. They must stay home. Restricted just means, okay, they're the ones responsible for, making the salads. Well, now we're going to have them only work a register, or maybe they are cleaning, taking the trash out, that kind of thing. So there's still some things that they can do to be able to still work. But your local health department is your resource for determining exclusion and restriction if you ever are in this situation. Okay. Another part that when the environmental health specialist comes to do the inspection, they are going to ask about a vomit and diarrhea cleanup plan. So hopefully all of you have been asked that. And so what that is a written plan that addresses the cleanup of any sort of vomit or diarrheal event in your establishment. And you may think, oh my gosh, that's never going to happen. I promise you it will happen. And then you need to know what to do and how to handle it. So in this plan, it describes how equipment is going to be cleaned up after an event happens, how you're going to dispose of the contaminants, who is responsible for the cleanup. We would prefer that whoever is handling food not be the one that has to go do this. And if they are, then they probably shouldn't go back to food handling afterwards. It may be a good idea for them to find a situation where they're not handling any food or clean utensils. And it also, this plan it should provide guidance for those employees that are responsible for cleaning up such events. They would need to monitor their symptoms to make sure that they do not end up getting whatever the possibly norovirus. Norovirus is highly, highly contagious. It only takes one or two viral particles to make someone sick. So that's why we see such a huge prevalence in it, and it does aerosolize. So if someone has a vomiting event, and those that are sitting around, there's a really high possibility that they could become sick as well, because it just gets in the air, we breathe it, and bam, we're contaminated, or yeah. So the goal of this plan is to limit contamination of the surfaces in the facility. So wherever it's at, hopefully it never happens in someone's kitchen. I hope it's just in the dining area or the common area. And then, so the picture on the screen is a little poster. It's kind of a quick and dirty reference guide, but we really want you guys to have, and this right here is this is just a snapshot. The picture on the left is the employee health agreement. The picture on the right is the first page of the vomit and diarrhea cleanup plan that the state actually created a little over 4 years ago. This is available from your local health department. The 4-page plan is very detailed, and this is what we're looking for when we come to do your inspection of your Congregate nutrition site. Okay. All right, so let's talk about time or temperature in establishments. So when we talk about time, and I kind of gave an example earlier where the food is removed from temperature control, and you're able to hold that food for up to 4 hours. And and the reason for that 4 hours, let's talk about that, because some people are just like, well, did we just pull a number out of thin air? I promise you we didn't. there is a lot of science that goes behind our numbers that we have in the food code. 4 hours is, when we talk about the life, kind of the lifespan of a bacteria, is it needs a certain environment to be able to grow. And if we're in that temperature danger zone, which is between 41 and 135, bacteria get excited and they start growing. Now, after up to 4 hours, it's still manageable. It's not growing at a pace that it's going to multiply so much that number of bacteria is not going to make you sick. But after 4 hours, and if you think about it, if something is being cold held and then they set it on the counter, it's going to rise. And then within 4 hours, you're probably pretty close to whatever the room temperature is, which, maybe it's at home, maybe at your facility that you're serving. If it's after 4 hours, you're probably looking at over 70 degrees. Well, that right there is the perfect environment for bacteria to grow. So that is why we limit it at 4. And then after that 4 hours, it would need to be discarded. Now, in order to use time, if you are the one preparing the food, you would need to have some written procedures on how you're going to handle foods that are going to use time. Your local health department is a great resource. They may even have like a template that you can use. And you kind of just fill in the blanks with the types of foods. You do have to find a way of marking this food. In all my years, I have not seen a congregate nutrition site to go for the serving period to last more than an hour, to be honest. But there may be a situation where yours is longer, so limit it to 4. If we're talking about temperature control, hopefully you guys all have heard that we want to keep hot food at 135 or above, and we want to keep cold food 41 or below. Okay, so when we receive food, what I was talking about earlier about temperature control, the van there on the top, this is like a hot holding unit in the back of a van. And then at the bottom unit, this is a big Cambro unit. And so this thing can either hold cold or hot, depending on the types of foods in there. These things actually work really well. So we want to know, how is the food transported? Is it just in a van or a car, or is it actually in a refrigerated vehicle? Is there a way to maintain that equipment going up and down the road? So how is the food packaged? Is it in like clamshell containers? Because I'm here to tell you those, it's going to be hard to maintain temperature. Is it wrapped in foil? Is it in these big, like full hotel pans with lids? Just that the packaging is kind of key. How far is the food being transported? I know I had a facility that was over an hour from where the food was prepared, just because of where this Congregate nutrition site was. It was just really far from everything. And but we never had any problem, or I never saw any problems with food temperatures, because the facility had a way to transport that food and maintain it hot during that transport. So is the temperature of the food checked before the food leaves the facility? I kind of hope it is, even at least before it goes in these hot holding units. A lot of times they brought logs with them of the food and what the temperature was when it left, and then they required the Congregate nutrition site, the person in charge there, to take temperatures when the food was received to make sure that they were good with receiving the food. There again, we want to make sure it's checked when you get it. Again, when you receive that food and you take ownership of it, it is now your food and your responsibility. So we want to make sure that food is maintained at a safe temperature, or they're using time correctly. So here, receiving food, what should the temperatures be when you when your food arrives? So it should be cold, should be 41 or below, right? We want hot food to be 135 or above. We want to make sure that foods are maintained at temperatures until service. So that could be you guys have a hot holding, like a serving line, and you make sure you turn that hot holding unit on well in advance. I even had my facility, sometimes they would go ahead and just turn the oven on to preheat it just in case something came in and it was not at temperature. The oven was already preheated and it was just a very seamless process and they could get that stuff heated back up. Again, maintain temperatures until served, and check those food temperatures using a calibrated thermometer. Hopefully everybody has to demonstrate that whenever your local health department, your environmental health specialist comes. They may ask, hey, can we use some ice and water and calibrate your thermometer? And we always want to make sure that it's cleaned and sanitized before we stick it in food. You will see your environmental health specialist when they're doing the inspection. They will use most of the time alcohol swabs, and because the alcohol in the swab actually dries pretty quickly. And so you're not, introducing any sort of chemicals into the food. If you can't calibrate your thermometer with ice and water, the inspector there coming to your facility will try to find another way to just make sure that your thermometer is measuring around the same temperature that the inspector's is. All right, we talk about sanitizer. We want to make sure that the sanitizer is at the correct concentration. So if you're using chlorine, which is, bleach and water, you're looking for 50 to 200 parts per million. That spray bottle there that's on the bottom right, that spray bottle is about 32 ounces. It only takes 1 or 2 drops of bleach in that whole bottle. So be very careful when mixing it up. We don't need a cap full or anything like that. That picture there on the left with the purple, the color indicator there, that test strip is really, really dark. So I say that one's probably more than 200 parts per million. So at that point, it's not a sanitizer, it's actually a chemical. And so we want you to add water and dilute it so we can get that nice purple color. And we don't want black on this strip. Quaternary ammonia, which you'll see up in the top right, those are the test strips for it. Some quats, depending on the manufacturer, can work at 150, but 400 is the max. A lot of times you'll see 200 to 400 is what your test strip is showing and what your sanitizer bottle, like the concentrate, is telling you to mix it to. So just follow your manufacturer's instructions. We want to make sure that you do have test strips, so please keep those on hand. Store them so they don't get wet. If they get wet, they're not usable anymore. You might as well just throw them away and get another one. Make sure your spray bottles are labeled as to what is actually in the spray bottle. And as far as if you use a sanitizer bucket, which is what's shown there at the bottom, make sure you store your wiping cloths in these buckets. Don't leave wet cloths just sitting around. We want to make sure they're stored in properly mixed sanitizer. So other general requirements, we want to make sure the equipment is clean and in good repair, make sure it works. Is the facility clean? Floors, walls, and ceilings. Maybe the shelves on the tables, making sure they're clean. Inside the cabinets, inside drawers. Do you have enough lighting in the facility? Poor lighting leads to unclean conditions like on surfaces, in drawers and in cabinets. But when you have adequate lighting, everything is nice and bright and shiny. You can see clean. So then you realize, oh, that needs some more attention. We want to make sure there's no evidence of pest. And your local health inspector may ask, like, do you guys have pest control? Do they come? How often? You may not know that answer because you may be in someone else's facility, but it might be a good idea for the person in charge just to ask wherever you're at, whatever facility you're at, if you just use their space, just ask them in just a general question how often they come. Um, and then we want to make sure any food, so maybe you guys keep some snacks, whether it be crackers, granola bars, things like that, making sure that they're stored properly, and making sure that clean utensils are put away, and stored properly as well. Food above the floor, we don't want food on the floor. The floor is considered a soiled area, so we don't want to transfer what was on the floor. If you pick that item up and then put it on a table, we don't want that same stuff that was on the floor to be on the tables. Okay, I've got to find a way to be able to see the chat. I can't see the chat, so this is not going to work well. Okay, so I'm going to ask you to type in the chat answers to these questions, and we covered most of these things. Julie, I may have to just get you to kind of blurt out what they're saying, if that's
Sure.
okay.
Yes,
Okay.
I definitely can.
Okay. So, what do you do when slaw arrives at the site at 54 degrees?
Okay, everybody. So think about what you would do if you had slaw arriving 54 degrees. Type what you would do in the chat. All right, I'm seeing throw it away, discard, reject, refuse, throw it out, reject, do not serve, trash it, and notify the caterer.
Perfect. That is awesome. Yes. So we just kept it simple and just said reject the food. And why? What temperature should we be looking for cold food?
Type it in the chat, everybody, if you know it.
Mm-hmm.
And I do have someone made a comment question that I want to call out too.
Okay.
Okay, so everybody's saying 41 degrees or colder. Great.
Perfect. Yes. So being at 54 degrees, it is in the temperature danger zone. And it is, if if we go too far, then it's enough time that we could actually make someone sick. So very good. Thank you very much for the participation. I appreciate it. So what about the next question here?
Well,
What
wait,
do you
Angie,
do? Oh, yeah, yeah. Go
sorry.
ahead.
Before we go to the next question, somebody asked a really good question. They
Okay.
wondered if you could cool down that slaw if it hasn't been 4 hours yet. What would your
So,
response to that be?
okay, that's a very good question. So if like a log comes with that food and for it to get to 54 degrees, depending on where they're at in the transport, if it was 41 when it left the establishment and it has only been an hour, let's say it's 95 degrees outside, I can see the slaw getting to 54 degrees if it wasn't properly transported. Um, but if you don't have a time, then we don't have any choice but to either reject or discard. But with it, if they have a time procedure, obviously, let's go back to this. If it was a time thing where the caterer has procedures, this is what they do. They prepare the food, cool it down. It gets transported. It's down to 41. It gets put in transport. They record the time. And then by the time it makes it to you, as long as it's served within 4 hours, it would be fine. But that was only if the caterer has approved time procedure. So there's going to have to be some communication there. If the intention is to receive it at 41, then I would, but if there's a time on the log, I would say that yes, you could cool it back down, but I don't know how you're going to do that. I mean, I guess you could stick it in the freezer, but you got to be careful because then you'll freeze cabbage, which is then the quality is not there. Um, so my answer is going to be it depends on some other
Mm-hmm.
factors. Does that
Yes.
help explain it?
Yes, yes. And this person is writing, not worth the risk, so toss it.
Yeah,
So
exactly.
yeah,
Exactly.
it could be, a quality assurance measure too. You asked for it to be received at 41 and it's not.
Mm-hmm.
So
Right.
and just so everybody knows, Angie alluded to the rules revision process early on in her presentation. And our goal with that process, which is currently underway, is that with the revisions, we will really clarify a lot of these areas that are a little bit ambiguous right now, like what are the proper, temperature procedures? What is the proper procedure for using time instead of temperature? Because the way that we have it written in our standards right now, it's not fleshed out in the way that it really should and could be. So we will be clarifying that for everyone moving forward. So I just wanted to mention that hopefully soon with our revisions, there will be just more streamlined, clear guidance.
That's good. That sounds great. Thank you, Julie. Okay, so let's think about this question. What do you do when hot food arrives to the site at 1:37?
Okay, so again, type your answers in the chat about how you would handle this situation. Okay, so I'm seeing when in doubt, throw it out. It's
Ooh,
still in the safe zone, so keep it warm. Reheat, depends on what it is. Warm in the oven to bring up temps. Close to temp, heat to maintain.
okay.
It's safe, stick in oven or warmer. Look at log time. So a lot of different answers here.
Okay, all right. So, what is our hot holding temperature? What's our minimum hot holding temperature?
I'm seeing 135, 135, lots of
Perfect.
135s.
Good. Yes. So, if it's 137, it's above 135. So, we're going to accept the food. And the reason being, of course, is because our hot holding temperature is 135 or above. So that one was a little like we threw that one in there. It was a little sneaky.
Yes.
But there's
And no, I appreciate this one, Angie, because this is something else that we'll be updating in our Division of Aging rules. The standards, exactly, Jennifer. She says the standards still say 140, I believe.
uh yeah.
So that is a big thing that we need to change because the danger zone is, the science has come a little ways
Mhm.
since I think the rules were originally written, and now we know that the danger zone is anything below 135, but we had it as below
Yeah.
140. So this is a great question to pose to the group
Yeah.
because that's an area that we need to clarify.
Yeah. So I've been around, and I did not tell y'all this, but I've been in environmental health for 27 years. Um, so I've seen a lot of changes over time. And when I started that many years ago, it was 140, um, and the cold temperature was 45. So we changed, I think, to 135. I'm thinking around 2008. We actually changed that before we even adopted the food code, which we adopted food code in 2012. Um, and the FDA food code was 41, but we didn't even change that until um, January of 2019. So it's just now been 5 years. I'm sorry, 7 years since we've adopted 41 degrees. So North Carolina was a little slow in implementing that, but we're we're now in line with the code. So okay, let's move on to the next one. What do you do when you observe mold on dinner rolls when they arrive?
Okay, I'm seeing throw them out, throw them away, reject, reject,
Perfect. Very good. Yes.
toss. Mm-hmm.
And of course, we don't want food that's been spoiled, and it definitely, we don't want it to be served. Okay, what do you do when you check the sanitizer bottle, which is bleach water, and has a concentration of 10 parts per million and no label?
How would you all handle that situation? Start over, pour it out, dump, redo, label
Perfect.
it, refill with proper measure, dispose, make a fresh bottle.
Yeah.
Okay,
So
great.
so the easiest thing to do, I mean, if it's already, it's a full bottle and it's at 10, you can just add a couple of drops of bleach to it, mix it up, and it should register between 50 and 200 parts per million. Definitely, and we always carry Sharpies around with us, so you probably could, if you don't have a Sharpie there at your um, site, you could more than likely you can say, "Can I borrow a Sharpie?" and just write bleach water, sanitizer, chlorine, sanitizer, however you guys want to, just as long as we know it is something other than water. I will say this, if you leave these out exposed to sunlight, it'll actually eat up all of that available chlorine in the bottle. And so therefore that may be the reason why this one is at 10. So I would recommend storing those kind of in a dark area, maybe under the sink or, you know, on a bottom shelf somewhere, just out of the sunlight. So um, temperature of the
Angie,
room. Yes.
thank you. Thank you for that. We had a question. If it's not labeled, how do we know it's only bleach?
Well, if it's not labeled, then the best thing to do, well, okay. We see this sometimes when people are like, well, this is the only bottle we have in here. We know it's sanitizer. And that's fine. You're not going to be able to smell it because if it's mixed properly, you're not even going to smell the chlorine in it. The best thing to do with that, if the PIC is like, I don't know what this is, we're not going to assume it's sanitizer. We would ask that they dump that out, clean it, clean out the nozzle and all that before you actually add it. And especially if you're going to turn it into a sanitizer bottle, there's a possibility it could have been used with ammonia in it. And if you mix ammonia and bleach, it creates a chlorine gas, and everybody in there will be like, we don't need people falling out. So the best thing to do is, um, if you don't know what's in it, then clean it, clean out the nozzle, clean everything out, and then start over. So yes, very good question. We're not going to just assume it's a um, sanitizer bottle, but we get people making these up. And I will say this, if you use a Sharpie on it and you drip some bleach down the side of the bottle, it'll erase the label. So you'll have to start over with that again too. So just, you know, don't make assumptions. Very good question. So therefore, 50 to 200. Um, so when you're working with your local health department, where you talk about the inspection process, we want to make sure we introduce ourselves, we state why we're there. We ask the person in charge, hey, can you walk with me? So that way that we can ask questions as we go. They're gonna, well, hopefully they're washing their hands before they even start anything. We do a quick survey of the facility, just to kind of look around, just to see what areas we need to inspect, what's going on, what's happening. And then the environmental health specialist should be asking a ton of questions. They're going to check and record your food temperatures. They're going to ask about employee health. They're going to watch your staff. They're going to make sure nobody looks ill. They're going to check your food thermometer. And if we can calibrate it, we're going to do that. They're going to check sanitizer. They're going to see if you've got test strips. They're going to look at the overall cleanliness and of the facility, and is all the equipment in good repair. Again, they're going to ask about the employee health policy and a vomit and diarrhea cleanup plan. And then if you are an establishment that uses time, they're going to want to look at your time procedure, the written procedures for that. And in order to use time, you have to have a written procedure. So we don't want just people just haphazardly using time. And just so you know, so if you've got a situation where you're having trouble with hot holding and time is mentioned, we can't, it's either one or the other. We have to kind of pick a path. So if you're going to stick with time, stick with time. If you're going to do temperature, we need to stick with temperature. We can't change it depending on if equipment is working or not. It's one of those, we just have to make a decision, decide which one you're going to use. So the environmental health specialist is going to fill out an inspection form, and they will go over that with the person in charge. In most cases, they're going to provide a copy, either a printed copy or possibility it could be emailed. And then they'll post a sanitation score when when they're done. So during this whole process, if you have any questions at all, please ask them while they're there. And if you still don't understand something, ask them again, ask it a different way, ask them if they can show you, demonstrate what they're trying to say. And they should be able to do that. Sorry, phone was ringing. So during that inspection process, there may be a situation where they're going to seek like immediate correction, which could be temperatures. Possibly, maybe they're there when the food is received, and this facility has the ability with an oven to reheat the food. And it's just too far away. The participants are sitting here waiting to eat. It's too far away for them to take it back to the facility they got it from and to get something new. So they've preheated their oven. They go and slide the food in there. And if there are questions during that process, please ask. And also, that right there is kind of the inspector is seeking an immediate correction. Because if not, that may be something that they have to come back and follow up on. So if they can see that you guys are correcting it while they're there, that is notated on the inspection report where a follow-up visit would not be required. So if they ask, for correction on things, we encourage and recommend everybody to try to work that out and try to do it. It may be a situation that you just can't, and they'll just make a follow-up visit to make sure that something is fixed. Maybe it's the refrigerator's not working, and that might not be something that can be fixed while the inspector is there. Okay, so any questions you have, I'm here to answer those. And all I can say is thank you for all that you do to keep everyone safe in your establishments. A contact information, if your local environmental health specialist is also a resource for food safety and sanitation. The website there on the screen is available. That is the state's website. There's a lot of good resources on there. There's the employee health policy, the vomit diarrhea cleanup plan sample. And I'm going to let you guys, I'm going to pause here for just a second. And then the last slide I have is the map again with phone numbers. And maybe you guys have your phone now and you want to take a snapshot. But I'll give everybody a chance to write down that email address or the website address. And one more slide. So there is our map again. These are all of our environmental health regional specialists with phone numbers. We also have email addresses, but that would make this slide really, really cramped and not be able to read it. So, but we're always available to answer any sort of questions.
Thank you so much, Angie. And again, we will send these slides out to you all. So you will have
Mhm.
the the email addresses, etc. Or I'm sorry, not the email addresses, but the regions and the phone numbers.
Yeah. Any new questions or anything for me? I was gonna scroll down. I can
Um,
see the chat now, so I'm gonna scroll down and see if I
Yeah,
see.
nothing major. Just a curiosity. Someone asked about, the News and Observer reports the low scores that some restaurants have received. Would congregate nutrition sites be in the media in that way? Should they um, have a low score? Do you know?
So it's possible because all of our inspection reports are public record. Anyone can request inspections, and most counties post theirs out on their website. A lot of times, and I'm not saying this is the case because I don't know for sure. And was that the News and Observer? Is that what
Hmm.
we said? Yeah.
Yes.
So I'm not sure what all the different media outlets that they use, like their resources. But a lot of times, I know when I worked here in Davidson County, we had the local newspaper, and they only wanted restaurants. So there's an identifying number at the top of your inspection report, and you guys are not a restaurant. So in the case of where I worked, you guys they wouldn't have received inspection reports from a congregate nutrition site. But it is not
Hmm.
impossible. It is highly possible. So just there's always somebody out there looking. Just know that.
Yes, yes. That's great to know that this is public record. So
Hmm.
I think that's important for everyone to be aware of. And, I think I talked a little bit about food safety in one of my previous sessions. And,
Hmm.
one thing I just remind people to think about is just like imagine the headlines. You don't want to be in the
Hmm.
news because people are getting sick at one of your sites. So, and that's like a very superficial thing. We don't want people to be getting sick at our sites at all. But, being in the news for it makes it even more difficult. But
Exactly.
we have a lot of questions. So let me try to call some of these out.
Okay.
One of them is, are meal sites required to keep bleach water with the dish rags in it?
Okay. So if the uh, wet or the wiping cloth is wet, it must be stored when and not in use in a container of sanitizer. Doesn't necessarily have to be bleach water, but whatever type of sanitizer that your site uses. Yes, that would be correct.
Okay, great. Another question is, if congregate hot food comes in under temperature, what is the proper method for bringing the food up to temperature?
So in that case, you're going to need to know how long has it been out of temperature. You don't know. So do most everybody do y'all receive like a sheet with your food that with the foods and then there's temperatures on it and maybe times? Is that kind of very common?
Yeah, yeah.
I
So
see. Yes, yes, yes.
yes, and
Okay.
we have our nutrition providers, document the time they
Mhm.
received, and the caterer should be providing them information as well. So I
Okay.
think most people would know how long that food has been in
Okay.
transit. Yeah.
And I think it's safe to say it's gonna be less than 4 hours. So
Yes.
if you have the ability to heat that food, which the rules require you to have a piece of equipment to do that, whether it's a microwave, a range, an oven, what have you, you can reheat that food. We would want to see that food reheated to 165, not
Mm.
just 135. Because when
Okay,
we drop
yes.
below 135, there could be some bacteria that's introduced. And if we reheat to 165, then we're taking care of all possible bacteria that we would be concerned about. Does that
That's
answer the
super
question?
helpful.
Okay, good.
Yeah, so just to clarify, you're saying that the method of reheating is not as important as that final temperature
Mhm.
of 165 if it has dropped below
Yeah.
um,
And yes, it
one.
can be done in a steamer. That would, I'm gonna be honest, that would probably be the preferred method because that will get it up very quickly.
Okay.
Um, yeah.
Okay, great.
Microwaves are
Um,
so uneven, so but some people, that's what some people have, so it's okay. I mean, as long as it'll fit.
right. Okay, so somebody else asked, our policy is temping when the food when it arrives. And if it does not temp, we use time. We get a printout of what the caterer temped the food and the time. Were you saying that it either has to be time or temp and that we can't use this current system as they're describing?
So the time that, so this is food that's coming from another facility. Do
Mm-hmm.
they have a time procedure?
Yeah, that would be the question.
Yeah,
Mm-hmm.
we may have to, we may have to talk about that one. Just,
Yeah, they're saying yes, they do have a time
oh, okay,
procedure.
yeah, then yes, you could serve the food within 4 hours from the time that the facility wrote on that, um, I guess the delivery sheet. I'm not sure what we call that. Um,
Mm-hmm.
but yeah,
Like,
that would be fine as long as the food is served within 4 hours.
yeah, and I think what you were saying earlier, Angie, it makes a lot of sense though, making sure that our procedures are really clear so we know that we're either using time or temperature, and it's okay to use time, but we want to make sure that both the caterer and our nutrition providers
Mhm.
are in that procedure so that the window does not get exceeded. Like we want to be thinking about the time that the food
Right.
we use the caterer and making sure it was at a temperature and including that into our procedure at the local level.
And
Okay, great.
so, and I can explain that just a little bit further. The what I meant by you have to pick a path is we don't want the inspector showing up and on this inspection, all the food temps and they're like, oh yeah, we're using temperature. And then we come back the next time and we start taking temperatures and everything is out of temp. You're like, oh yeah, um, if it's not at temp, we're using time. No, we gotta decide. Either it's time when that food is received or it's temperature when that food is
Mm-hmm.
received. Does
Mm-hmm.
that, hopefully that clears it up a little bit.
I think it does. And again, for everyone who's still on the call with us, we will be clarifying all of this in our rules revisions too.
Yeah. Very good.
So I haven't seen any new questions, but we do have a couple more minutes if anybody has anything burning that they would like to ask Angie. Again, I have not sent out information on the quote unquote makeup classes or the recordings. So that's going to be coming really soon. You will have instructions about how to access those and get credit for watching them after the fact because we have record of everyone who attended live and we'll be sending certificates soon. But when you watch them on demand, we're going to have a form that you fill out online to just attest that you have watched, and then you'll get the certificate later. So please stay tuned for that information. I apologize, it did not come in mid-December as we thought, but it will be coming very soon. And I really appreciate everybody's presence today. Angie, you're getting Leonardo
I
DiCaprio
see that.
applause. So that's awesome. I always learn something listening to you. So thank you
Oh,
very, very
y'all are very
much.
welcome. Y'all are a
Lots
great
of thank
crowd.
yous and yeah. So if you've gotten what you need today, you are welcome to log off. Let me, before you do go, This is the link to our evaluation for the session today. We'll be sending this out via email as well. Please fill it out. We want to know what you thought about what and how you learned today. And yeah, have a wonderful afternoon. We'll be on for just a couple more minutes and be in touch with any questions. All right, thanks everybody. Have a wonderful afternoon.
Julie, thank you for having me. I appreciate it.
You're welcome. Thank you so much, Angie, and I will share the results from the survey
Sure.
with you once we get that. And be in touch about rule revisions as well.
That sounds good.
All right,
All
thank
right. Take
you.
care.
All
Bye.
right,
Bye,
you too.
everybody.
Bye.